So our next topic is pertussis or whooping cough. Pertussis is also a bacterial infection of the lower respiratory tract. The bacteria that causes is responsible for pertussis or whooping cough is Bordetella pertussis. It is common in unvaccinated children, but it can also occur in adults as well. So what are the features of pertussis? Paroxysmal cough, vomiting after coughing, inspiratory whoop. Infants may not have the inspiratory whoop but may have episodes of apnea or cyanosis. So for Plab 1, you need to remember that if in the question stem they mention that a child gets bouts of cough or paroxysmal cough, bouts of cough that is followed by vomiting or cyanosis. Remember that whooping cough is also worse at night. And there is one more condition in which the cough is worse at night, and that is croup. Then how you are going to differentiate between croup and pertussis? To differentiate between croup and pertussis, remember that pertussis is common in unvaccinated children, and the clinical features of pertussis is different from croup. In croup, cough is worse at night. In pertussis, cough is also worse at night, but the typical features of the cough such as bouts of cough that is followed by vomiting or cyanosis. So these 2 points are important. That is bouts of cough that is followed by vomiting or cyanosis. Then your diagnosis will be pertussis and not croup. The only feature of croup is barking cough that is worse at night. There is no vomiting after cough or there is no cyanosis after cough. While in pertussis, both of these feature or one of them will be present along with bouts of cough. The investigation is done with pernasal or nasopharyngeal swabs, and the treatment is macrolides such as clarithromycin. So the features to make a diagnosis of pertussis is bouts of cough that is worse at night, that is followed by vomiting and associated with central cyanosis. Another hint to make a diagnosis of pertussis is that the child has never received vaccination. So pertussis is common in unvaccinated children. Diagnosis will be confirmed with pernasal and or nasopharyngeal swab for culture and sensitivity for Bordetella pertussis. Now the management is claricid. Infant under 6 months with suspected pertussis should be admitted. So infants whose age is less than 6 months and there's suspicion of pertussis, they should be admitted. An oral macrolide such as clarithromycin, azithromycin, or erythromycin is indicated if the onset of the cough is within the previous 21 days to eradicate the organism and reduce the spread. Remember that household contact should also be offered antibiotics. And children should be excluded from school for 40 antibiotics from onset symptoms. So in short, the management of pertussis is oral macrolides such as clarithromycin, azithromycin, or erythromycin if the onset of the cough is within the previous 21 days. And also antibiotic prophylaxis should be offered to household contacts such as siblings and anyone who is in contact with the patient. And the patient should be excluded from school for 48 hours after commencing antibiotics. Complications of body teleporthosis include seizures, subconjunctival hemorrhage, pneumonia, and bronchiectasis. Remember that we discussed in the gynae chapter as well that pregnant women need to receive IP vaccine. Two vaccines are given to pregnant females in UK, that is influenza vaccine and pertussis vaccine. And pertussis vaccine usually come along with diphtheria and tetanus vaccine. So influenza and DPT vaccines are given to pregnant females between 20 to 32 weeks of gestation. Now let's just discuss an example. A 9-month-old infant presented to the accident and emergency with his mother as she complains that her baby is having bout of cough that are increasing in severity for the past 9 days. So we have got our one hint, that is bout of cough. So bout of cough is only present in pertussis. On examination, the child was noted to have bouts of cough followed by blue lips. So bouts of cough that is followed by blue lips or cyanosis. Again, we got a second hint for bordetella pertussis. The child has never been immunized because this prevents parents are against vaccination. So we got the third hint that the child is unvaccinated. What is the best investigation? So we are suspecting bordetella pertussis most likely, and the best investigation is to do a paranasal and nasopharyngeal swab. So we can see that bordetella pertussis is common in unvaccinated children. Can somebody tell me which is the other condition that is common in unvaccinated children?
Hemophilus influenza type B. Hep.
Hemophilus influenza type B causes which disease?
Epiglottitis.
Yes, acute epiglottitis. So acute epiglottitis is common in unvaccinated children, and bordetella pertussis is also common in unvaccinated children. There is a clear difference between their clinical presentation. In the case of acute epiglottitis, there was stridor along with drooling of saliva and thumb sign. While in bordetella pertussis, there is bouts of cough followed by vomiting or cyanosis, and common in unvaccinated children. So the most or the best investigation is paranasal or nasopharyngeal swabs, and the second line investigation is PCR and serology. So this was all about the respiratory problem in infants and children.